The average retired couple in America will spend $330,000 on healthcare. That's according to Fidelity's 2025 retiree healthcare cost estimate, and it doesn't even include long-term care. Now here's the thing. The single biggest tool you have to manage that cost is Medicare. But Medicare is also one of the most confusing programs in the entire federal government. 4 parts, lettered A through D. Supplemental plans lettered A through N. Enrollment windows that open and close on specific dates. And penalties, permanent penalties, if you miss them. Today I'm going to walk you through all of it. Every part, every cost, every enrollment window, and the brand new 2026 changes that could save you thousands of dollars on prescription drugs. This is the only Medicare video you'll need this year. Before we dive in, everything in this video is education, not individual financial guidance. Everyone's retirement looks different, but if you're ready to have a real conversation about your retirement goals, scan the QR code on your screen right now to book a free consultation with a qualified professional. All right, let's get into it. So who is Medicare for? If you're a United States citizen or a permanent resident who has lived in the country for at least 5 consecutive years, you become eligible for Medicare at age 65. You can also qualify earlier if you have certain disabilities or end-stage renal disease. But for most Americans, 65 is the magic number. Now, Medicare isn't one program, it's actually 4 distinct parts, each covering something different. Think of it like a building with 4 floors. Part A is the foundation, hospital insurance. Part B is medical insurance for doctors and outpatient care. Part C is an alternative delivery system called Medicare Advantage. And Part D is prescription drug coverage. Let's start at the foundation. Part A covers inpatient hospital stays, skilled nursing facility care, hospice care, and some home health services. The good news? If you or your spouse paid Medicare payroll taxes for at least 10 years, so that's 40 quarters, you pay 0 premium for Part A. If you don't have enough work credits, the 2026 premium is either $311 per month with 30 or more quarters, or $565 per month with fewer than 30 quarters. According to the Centers for Medicare and Medicaid Services, that's the full premium for 2026. Now, even with premium-free Part A, there are costs. The inpatient hospital deductible in 2026 is $1,736 per benefit period. That's not per year, it's per benefit period. If you're hospitalized, discharged, and then readmitted within 60 days, it's the same benefit period. But if more than 60 days pass, you pay that deductible again. After the deductible, the first 60 days are fully covered. Days 61 through 90 cost you $434 per day in coinsurance. And if your stay exceeds 90 days, you dip into your 60 lifetime reserve days at $868 per day. Part B covers doctor's visits, outpatient care, preventive services, lab tests, durable medical equipment, and mental health services. Unlike Part A, everyone pays a premium for Part B. The standard monthly premium for 2026 is $202.90. That's an increase of $17.90 from 2025. Most people have this deducted directly from their Social Security check. The annual deductible is $283. After you meet that deductible, you typically pay 20% of the Medicare-approved amount for most services. There's no out-of-pocket maximum on original Medicare Part B, and that's a critical detail we'll come back to. Now, this is important, and if your income is above certain thresholds, you'll pay more. This is called the Income-Related Monthly Adjustment Amount, or IRMAA. For single filers earning above $109,000 or joint filers above $218,000 based on your tax return from 2 years ago, your Part B premium jumps from $202.90 up to as high as $689.90 per month. That's a cliff. Going even $1 over the threshold triggers the surcharge. Part D covers outpatient prescription drugs. It's delivered through private insurance plans, either standalone prescription drug plans or bundled into Medicare Advantage plans. Let's run the numbers for 2026. The national base beneficiary premium is $38.99 per month, though your actual premium varies by plan. The maximum deductible a Part D plan can charge is $615. Here's where it gets really interesting. Thanks to the Inflation Reduction Act, 2026 brings historic changes to Part D. Your total annual out-of-pocket spending on covered prescription drugs is now capped at $2,100. Once you hit that number, you pay nothing for covered drugs for the rest of the year, zero. That cap was $2,000 in 2025, the first year it took effect, and it's been adjusted for inflation to $2,100 for 2026. Before this law, there was no cap. Some beneficiaries were paying $10,000, $20,000 or more per year for medications, and there's more. The government has now negotiated prices directly with drug manufacturers on 10 high-cost medications for the first time in Medicare's history. The discounts range from 38% to 79% off the 2023 list price. According to CMS, this will save the Medicare program $6 billion per year and beneficiaries $1.5 billion in out-of-pocket costs annually. Plus, if you use insulin, your copay is capped at $35 per month, regardless of the drug's actual cost. IRMAA applies to Part D as well. Higher income beneficiaries pay an additional $14.50 to $91 per month on top of their plan premium. Part C, Medicare Advantage, is an alternative way to get your Medicare benefits. Instead of Parts A and B from the government and a separate Part D plan, a private insurance company bundles everything into one plan. Most Medicare Advantage plans include prescription drug coverage. According to the Kaiser Family Foundation, about 51% of all Medicare beneficiaries, more than 35 million people, are now enrolled in Medicare Advantage. 2/3 of these plans charge no additional premium beyond your standard Part B premium. The biggest advantage? Medicare Advantage plans have an annual out-of-pocket maximum. Original Medicare does not. The biggest trade-off? Provider networks. With Original Medicare, you can see any of the roughly 900,000 physicians who accept Medicare anywhere in the country. With Medicare Advantage, especially HMO plans, you're limited to the plan's network. Here's something to watch in 2026. According to a study cited by the Medicare Rights Center, approximately 2.9 million Medicare Advantage enrollees, about 1 in 10, were forced to find new plans because insurers exited their markets. And many plans are reducing supplemental benefits like dental, vision, and hearing coverage. If you choose Original Medicare, Parts A and B, you'll want to consider a Medicare supplement plan, also called Medigap. These are private insurance policies that help cover what Original Medicare doesn't: coinsurance, copayments, and deductibles. Medigap plans are standardized by letter, Plan A through Plan N, and every Plan G from one company covers exactly the same things as Plan G from another company, only the price differs. The average premium for a new Medigap enrollee at age 65 is about $189 per month, though this varies significantly by location and insurer. The number that matters here is your enrollment window. You have a 6-month open enrollment period that starts when you're both 65 or older and enrolled in Part B. During this window, insurance companies must sell you any Medigap policy at the standard rate, regardless of your health. Miss that window, and they can deny you coverage or charge you more based on pre-existing conditions. This is one of the most expensive mistakes in all of retirement planning. Let me be direct about this. Medicare enrollment timing can cost you thousands of dollars in permanent penalties if you get it wrong. Your initial enrollment period is a 7-month window. It starts 3 months before the month you turn 65, includes your birthday month, and extends 3 months after. This is your window to sign up for Parts A and B. If you miss it and don't qualify for a special enrollment period, for example, you're still working and have employer coverage, you'll face penalties. The Part B late enrollment penalty is 10% of the premium for every full 12-month period. You could have had Part B but didn't. And this penalty is permanent. You pay it for as long as you have Medicare. The Part D penalty works similarly. It's 1% of the national base premium. That's about 39 cents in 2026. For every month you went without creditable drug coverage. That adds up, and it never goes away. Beyond initial enrollment, the annual enrollment period runs from October 15th through December 7th each year. This is when you can switch between Original Medicare and Medicare Advantage, change your Part D plan, or adjust your coverage. Changes take effect January 1st. If you're in Medicare Advantage, there's also the Medicare Advantage open enrollment period from January 1st through March 31st, where you can make one change, switch to a different MA plan, or return to Original Medicare. Here's what catches many retirees off guard. Medicare does not cover long-term care. It does not cover most dental care. It does not cover routine vision or hearing exams in most cases. It does not cover care outside the United States, except in very limited circumstances. And it does not cover custodial care, help with daily activities like bathing and dressing. These gaps are exactly why the fidelity estimate is so high. The $330,000 figure assumes Medicare coverage. The gaps on top of Medicare are what drive the real cost. Think of it this way. If you're approaching 65, here are the 3 things to focus on. First, mark your enrollment window. Know exactly when your 7-month initial enrollment period starts and do not let it pass without enrolling. Second, decide between Original Medicare plus Medigap plus Part D or Medicare Advantage. There's no universally right answer. It depends on your doctors, your medications, your travel patterns, and your tolerance for network restrictions. Third, check your income. If your modified adjusted gross income from 2 years ago is above $109,000, filing single, or $218,000 filing jointly, plan for IRMAA surcharges. And if you're doing Roth conversions or selling assets, know that the income spike will hit your Medicare premiums 2 years later. Let's recap the numbers that matter for 2026. Part B premium, $202.90 per month. Part A, deductible, $1,736 per benefit period. Part D, out-of-pocket cap, $2,100 per year. And the IRMAA threshold, $109.
Hey, before you go, if you're serious about your retirement, we'd love to help. Scan the QR code on screen right now or visit the link in the description to book a completely free strategy session with a qualified professional. It only takes a couple minutes to fill out, and there's absolutely no obligation. Take the first step today. We'll see you in the next one.